Hey folks, so if you can't tell by the fantastic background, I'm back in the hospital, yay. Yeah, I'm real thrilled. It's 8 p.m. and I believe it's June 10th. I forgot to check before I started the video. But some of you know I used to do these video posts while I was in the hospital and I kind of got away from it for a while because it was just too much work. Well, I kind of want to talk about it this time because things are different due to the COVID pandemic. Like the way they're running the hospital is a little different. So first I'm going to talk about my experience so far in the few hours that I've been here. Then I'm going to talk about the COVID stuff, which I don't have COVID to my knowledge. I haven't technically been tested yet, but I don't have enough of the COVID symptoms to really be afraid of that. Excuse me. So I got to the hospital at 4. Got to my room at 6. And now it's 8. So I've been here for like 2 hours. They still haven't put in my orders for any of my medications or food or anything like that. So I'm not going to be able to eat tonight because the kitchen's closed. Yay. I planned ahead and brought chips. But yeah, I brought basic essentials, phone, tablet, laptop, some notebooks, stuff to do. I haven't broken it all out yet though, for the following reason. They put me on Cranert, which is the 6th floor of University. I'm used to being on 2 North, which is 4 floors down. And I kind of knew they were going to do this because a friend of mine who has CF was just recently admitted to the hospital and kind of told me some of this. So I kind of expected to not go to 2 North. But I guess what they're basically doing is they're putting their normal CF patients in different floors upon admission so that they can get tested for COVID. And then if they have COVID, they're kicked out of the hospital and sent to a different hospital. So people who have COVID are not allowed to be admitted to Indiana University Hospital right now because it is a highly pulmonary and highly transplant hospital. So like almost all the patients here are like highly immunocompromised. So it would be really dangerous for there to just be people chilling with COVID all over the place in the hospital. So anybody who's worried about me getting COVID while I'm here, probably not going to happen, which is awesome. So yeah, they're going to screen me for the COVID. They're going to do a normal respiratory virus panel, which I don't know if those are like the same thing or if they're going to swab my nose twice. Which either's fine. I don't care. So they're going to do that. Going to do a chest x-ray. I guess my lungs are really tight sounding and really crackly and wet and gross right now. So I'm expecting at least to be told that there's some junk built up in there. Basically my symptoms are shortness of breath, needing the oxygen more, and like an inflated amount of coughing and phlegm production. So that's been no fun. And because of these symptoms, I haven't been able to keep up with also fatigue. A lot of fatigue. So because of these symptoms, I haven't been able to keep up with stuff around the house or the kiddos very easily. And I just kind of gave up on trying by myself and decided to call my doctor and tell her what was going on. And she decided that it was probably best to admit me. I have not had a pulmonary function test yet. If and when I get one, I will, of course, update so that people know like what's going on there. I'm hoping to get back into blogging while I'm here. A bunch of crap has happened in the past 2 weeks that is just like made it really, really hard for me to be motivated about things. Because I got that really crappy news about lung transplant, which most people who personally know me know about. Basically, the hospital told me I was going to get listed for transplant in June. And then a week after they told me that, they decided I'm not sick enough to list for transplant. So I'm still kind of dealing with that emotionally, which has really depressed my motivation. And then I also had a surgery 6 days ago. I had my fallopian tubes removed. So I'm a little, like, tired from that. And still in a little bit of pain, but not, like, a lot of pain. From having that surgery done. There is a chance that, like, this is just the surgery knocking me off my feet. But just in case it's something else, like pneumonia or bronchitis, I don't think it's bronchitis, but like pneumonia or the flu or something like that, I would rather know, because I don't want to get the kids sick. Or Joe. For those who don't know, Joe is the fiance. I love him. And he's kind of struggling with me being gone. Because since we met, I think there's only been one day that we didn't see each other. Every other day we've seen each other. So not being able to see each other while I'm in here is going to be hard. Because we're not used to that at all. And this segues me into the COVID stuff. So the things that are different are as follows. They screen for COVID on a different floor than what they normally put CF patients on. Once you test negative, they'll transfer me over, or let me rephrase that because I'm using like all sorts of weird pronouns. Once they test negative for the COVID, the patient gets transferred to 2 North. So when my test comes back negative, which should be like 24 or 48 hours after they take the test, I'll be transferred down to 2 North where I'm used to being. Well, while I'm there, I'm not allowed to leave the floor, which is annoying. And we're only allowed 1 visitor per day. Not 1 visitor at a time, 1 visitor per day. So, like, say my buddy Andy wants to come see me on the same day that Joe wants to come see me. They have to fight for that place because only one of them gets to come see me. So, that's going to suck, balancing all that and trying not to make anybody feel like I don't want them here because I want to see somebody else too. So also, this is going to be my moment to say, do not surprise visit me. Because while I appreciate the sentiment, you might get kicked out. Because either A, I already have plans to see somebody and I'm not backing out of those plans, or B, somebody's already come to see me and you won't be allowed in my room. But yeah, I don't know exactly what platform I'm going to post this video on yet, or if I'm just going to like link it in my website and then post it on various social medias that it exists. But I'm going to try to update at least once a day, just to kind of let people know what's going on and to just talk about it out loud while it's happening. Because believe it or not, like, talking to this camera is actually kind of therapeutic when you're in the hospital. Whether or not I share it is up to me. But doing the talking as if I'm going to share it with people makes me feel better. I probably don't sound significantly sick right now. That's probably because I just had coffee. Yeah, that's probably because I just had coffee. And I'm trying to be, like, alert and oriented for all the doctors that are coming in and out right now. But yeah, that's pretty much it. Also, my tongue looks gross. Sorry. That's also probably from the coffee. I need to brush my teeth. Okay. Well, I'm gonna get off here for now. Probably won't update again until tomorrow, but if I do, whatever. And I will definitely update when I get some results back from, like, X-ray, RVP, COVID test, all that fun stuff. But hey, at least I know I'm not pregnant. I don't have fallopian tubes anymore. So that's an interesting difference between the last time I was in the hospital, which was like 5 months ago almost, which is weird. I'm rambling, so I'm gonna get off here. Keep smiling.